Hi everyone. Our subject today is the back, and there's lots to talk about. We're going to take a journey that allows us to look at the back through both the physical/medical lens, but also through a yogic lens. The spine is so important. It is the part of the body that holds us upright. It is like a supportive pillar. The back is involved in a lot of movement. Flexion, when you bend forward. Extension, when you bend back. Lateral motion, bending side to side. And twisting. Of course, in this day and age, much more time may be spent sitting, which can create its own problems. And well, one thing I found during my research is that back pain can come in many different ways and for many different reasons. These can include lordosis, where the lumbar spine overarches, herniated discs and pinched nerves caused by overexertion, arthritis, which manifests from inflammation, stenosis, a narrowing of the spinal cord, spondylolisthesis, when a disc slips and there is bone on bone, fibromyalgia, whose origin is unknown, and pregnancy, from carrying that extra weight. In addition, sacral strains can result from injury, or there may be sacral joint dysfunction causing an imbalance in the joints. Of course, anyone with back issues should see a doctor prior to starting to do yoga. That being said, with a qualified instructor, many will greatly benefit from the healthful approach yoga provides. And you can work with a yoga teacher to design a program that is targeted at the particular back problem you have, since there will be a different approach for different issues. It's a fact that back problems have become epidemic. So how can yoga help this? Well, we'll look at that, but first let's do a quick lesson on the spine. It's divided into 4 sections. Cervical spine, the 7 vertebrae at the top near the neck and connecting the spine to the skull. The thoracic spine. These 12 vertebrae cover the area behind your ribs and at the mid to upper back area. The lumbar spine. This is the lower back area and consists of 5 vertebrae. And the sacrum. That's the 5 vertebrae at the bottom of the spine that come together as a single bundle at the lower back. Sacrum means holy bone, for it is considered by some to be the foundation of the body. As a side note, the area below the sacrum is where the tailbone, as the medical term is coccyx. The connective tissue that connects muscle to bone is called a tendon. A ligament is the same idea, but it connects bone to bone or keeps an organ in its proper place. Note, too, that it is important when looking at the back, especially from a yogic viewpoint, to also observe the role of the fascia, because in the holistic way of yoga, this fascia is a continuing web of connective tissues. When the fascia is part of the muscle motion, the word myofascial is used. Now, if the myofascia is too tight, it means that the muscles can't lengthen properly. Yoga can help, first of all, by its simple ability to calm the mind and body. Yoga tells your nervous system to move into relaxation mode, where the parasympathetic nervous system is ignited. That's the part that calms the heart rate, soothes the muscles. It's the opposite of what is happening when we're running around caught up in our flurry of everyday activities, fight or flight. The sympathetic nervous system in action. Now, yoga might not get rid of stress completely for most of us, but it does allow us to deal with it in a better way, as though we were the masters of our thoughts rather than the other way around. This extends into our way of perceiving and reacting to pain as well. Now, related to this, of course, is the breath work we do in yoga, also known as pranayama. This can be very helpful with our relationship to our back pain. The long, focused breaths allow us to gain control over our thoughts and to also physically release the tightness in the muscles. This type of breathing also assists the vagus nerve, which is involved in the stimulation of the parasympathetic nervous system. And that is good because it tells the heart to relax while you are exhaling fully and completely. The long breaths in and the long breaths out allow ujjayi, or ocean-sounding breath, to work its magic of controlling the sympathetic nervous system and thus the fight or flight response. As you elongate that exhalation over time, that part of the nervous system is more aggressively stimulated. Now, as you practice your poses, notice your breath. When you are intent on the breath as well as the body, the mind draws inward, and it can then observe the way the body and the back is feeling. If you can keep your breath long and relaxed, it will help to open up tight places, but also brings in lots of fresh oxygen and prana into the body. Let's also think about how we're standing right now. Remember the practice of svadhyaya that we employ as part of the niyamas, where we observe ourselves. It's good to stand straight and tall, but we may hunch over or stand in awkward positions as part of our job. So we just need to self-correct by adjusting and aligning the body. It's not just about the physical stuff either. We know that we can feel the shoulders drop or the chest cave in when we are in the midst of emotional trauma or grief or such. At these times, we also, from a yogic standpoint, close our hearts in order to protect ourselves. What's cool, though, is that when you stand tall and open the chest, it feels good. And by going into Tadasana, or mountain pose, you can look in a mirror and see if you are aligned. Are the hips over the knees, over the ankles? Are the neck and head aligned with the spine? Taking a closer look at the anatomy of the back, we have the sacrum at the base of the spine, located about halfway between the head and the feet. The design of this sacred bone is divinely superb because of the way it attaches the upper and lower bodies and allows a way of distributing outside forces without much impact on the joints. Of course, this is true if your spine and hips and sacrum are all in balance. If not, this beautiful sacrum can be painful. The 5 vertebrae closest to the sacrum form a triangular bone that is able to support the weight of the body, and it also secures the spine to the back of the hips. In addition, it performs like a shock absorber, allowing the weight to be transferred and directed to the legs and to temper the forces of gravity and contact with the ground as well. At the bottom of this sacral bone is its connection to the top of the thigh bone, and that is via the piriformis muscle. If this piriformis muscle is too tight, it will pull on the sacrum or other bones, causing them to be out of line. The gluteus maximus muscles are the ones that are at the buttocks, start at the bottom of the sacrum. The mobility of the sacrum is dependent in large part on the abilities of the piriformis and the glutes. There are also 2 more significant muscles, the psoas major and the iliacus. These are deep muscles in the middle of the body that run from the base of the spine to the thigh bones. If the psoas muscles are tight, there can be a pulling forward in the lumbar spine, that bottom part, and the top of the sacrum, and weakness in the muscles of the abdomen in the back of the hips. The best place for the sacrum is in a balanced position. In yoga, we think of that pelvic area as a bowl that we attempt to keep in an upright position. There is a tendency for the sacrum to tip forward slightly, known as nutation, when performing a back bend, and to tip backwards, known as counternutation, when doing a forward bend. So there can be problems with the sacrum if it is not balanced. This can happen as a result of injury, repetitive movements, stress, or just something that is structurally wrong with the body. For instance, some people have one leg slightly longer than the other. I have a student like this. Now, how do we bring the sacrum into a balanced place in yoga? Well, we help it to be centered and aligned in relation to the hips and the spine. And that can happen by strengthening the hip muscles, the lower back muscles, and the core muscles. Now let's look a little closer at the energetic piece of this. The sacrum is translated as holy bone, and it is an ideal place for the flow of energy throughout the body. There are 3 chakras involved in this area of the body. The first is the root chakra, or the Muladhara, which is where we experience our security and centeredness. At the sacral chakra, or Svadhisthana, our creativity is nurtured, and it is also home to our dharma, which is our own personal nature, with our own characteristics. At the top of the sacrum is that 3rd chakra, the Manipura, where our personal power exists. This is the chakra of heat and fire, so it's important to balance this too. Too much heat in the body is too much, and it might be felt in the body as a burning sensation in that part of the body. Of course, in yoga, we believe that we have many channels of energy running through the body. These are called nadis in Sanskrit, and the nadis make up a complex network that carries energy and prana to all parts of the body. There are about 72,000 in the body, but the main ones are the Sushumna, the Ida, and the Pingala. The Sushumna runs up the center of the body, and the Ida and Pingala are to either side of the Sushumna nadi, and they cross over it at intervals. They cross first at the sacrum, and this awakens that Kundalini energy there, giving powerful energy to that area. So back to the question. How does yoga help? Well, it's been shown to be as good as pain meds for lower back pain for many individuals. It can be as effective as physical therapy, as shown by research at Boston Medical Center, which included input from yoga teachers too. My teacher, Kathy Mann, was one of them. When starting, 70% of the participants were on pain meds. But at the end of the 3 months of yoga, only 50% were taking them. In those in that group that included education but not yoga, there was no decline in the use of medicine. Additionally, a study published in Complementary Therapies in Medicine looked at work carried out in India in a trial of 80 patients with chronic back pain, defined as lasting longer than 3 months, showed that yoga therapy was more effective than physical therapy with regard to a reduction in pain, anxiety, and mobility of the spine. Back pain is the 2nd most common cause of disability in this country, and costs run about $90 billion a year. And back pain can take many forms. It can be a dull ache or sharp pains. It can come as a result of injury from an accident or from lifting something that is too heavy, and it can also be the result of changes in the spine caused by aging. Interestingly, and as a side note, those with lower incomes are affected more by chronic low back pain. The way back pain has typically been treated is with pain medications and surgery. But we're starting to understand that it might be better treated with exercise and yoga, which includes meditation and breath work. Of course, our healthcare system supports the former treatments, but not so much the latter. We are starting to see some changes to that recently, with doctors referring people to yoga classes and insurance covering gym memberships, but we have a ways to go, I think. Although certainly some surgeries are justified and necessary, perhaps we should lean more towards a holistic approach whenever possible, especially in view of the ongoing opiate crisis. So now we will move to the mat. Remember to do only what you are able to do and to always honor your back and all the rest of your body. So we begin here today in this position. I have a bolster and a pillow and some blocks. If you don't have a bolster, you can fold a blanket to be about this length, and you probably won't get it as high, but even a little bit will help you to open up the chest. So in this position of Supta Baddha Konasana, or a bound angle, we open up the chest. We open the hips up a bit here and bring the soles of the feet together. This position is good for sciatica. And we just draw our attention to the breath. We focus on the inhalation and the exhalation. We allow the mind to rest as we just let our concerns drift away. We know that the mind is very busy. And so for a while in yoga, we just try to calm the mind down, the monkey mind as we call it in yoga. Just trying to calm that down and rein that in a bit, bring some tranquility to the mind. And we do that by using the breath as the vehicle. So we just notice the inhalation and notice the exhalation. And as we just rest here, we allow for the certain release in the body too. And as we open up the chest, we're stretching the pectoral muscle, what they call the pecs there, right along the upper chest. And this is good for the back because if we're too tight in the pecs, then we're going to, the upper arm bone, the head of that upper arm bone is going to rotate forward and in. And if you notice, that's going to cause the rounding of the shoulders and the chest to collapse. And it also pulls the spine, pulls a muscle from the shoulder, away from the shoulder blades, away from the spine and forward. So that causes displacement along the spine or in that area, and also weakens the myofascia of the spine area. So we just allow this to stretch that and open that. So just relaxing all the muscles of the face and drawing the hands, just place them onto the abdomen, let the elbows rest on the floor. And we just for a moment have a sensation of that feeling of the abdomen under the hands. As we inhale, we feel the abdomen rise up to fill the hands, and as we exhale, it descends. So just for a moment, take a couple of big breaths, filling up that abdomen area. Exhaling completely, and again, another breath. And exhaling. So we notice the warmth beneath the hands. We're always encouraging this awareness, cultivating this mindfulness in yoga of paying attention to the body. We can just release the hands, and you can release the legs from the block and just allow the legs to go long. And we'll extend the arms behind us and push the heels away, stretching the body, just pressing the feet, pulling back with the arms. So we just take a breath here. We're creating a little spaciousness in the chest. And then exhaling down. Just coming in time with the breath. And then pointing the feet and flexing them, and pointing and flexing. And we ground down with the back of the calves as we do that, pointing and flexing, nice stretching the hamstrings and the calves, and then pointing and flexing again. And then just widen your feet a little and turn the toes just slightly inward, like in a pigeon toe type of thing. And now point the feet. And notice how that changed the sensation in the legs. And flex, and point, and flex. And once again, pointing the toes just inwards a little bit. You'll notice that nice inner rotation of the thighs, which we feel in a lot of the poses, right? When we do plank, we have that, and in eagle, so we get that going on. And then bring that back up, bring them back to hip distance, and just slide your heels back and forth. So we just get some invigoration and circulation going in the legs. And then bring them apart a little bit, make some circles with them. So keep it slow, and just lubricating the ankles, and then the other way, warming them up. And then bring your big toes together as the heels are slid apart there. And then point them forward again, getting that nice stretch in the inner groin. And then coming back up. And extend the arms again long, just really stretching, and exhale down. Bring your feet to the floor one at a time. And just gently, we're going to just a little bit, so it's not a radical movement here, just gently rocking the knees side to side. We kind of notice that feeling, and then come back up to center. And just as you lift up, take the top of the buttocks flesh and just move it down towards the heels. So you create a little more of that that pelvic tilt. And now just back and forth, and you'll notice the sensation a little bit lower on the back, perhaps. And then coming back to center, and just rock your head back and forth a little bit, just warming up the neck. And then coming back up to center. Once more, extend your arms and legs. And stretch a little through the right side, a little more through that right side. And then stretch a little more through the left side. And then stretch the whole body, and exhale your arms down. And then we'll just come up and just move the bolster over to the side in the pillow. And coming back down to a flat back on the floor. So let's again stretch the body. And then relax the arms there and just let them rest on the floor. And then just do a slight pelvic tilt. So we push that lower back into the floor. When you do this, make sure your toes are up towards the ceiling and they're centered on the heels. And just pressing in there and then releasing. So this is good to warm up the lower back. And releasing. And once more. Pressing that lower back in and then releasing. Bring the arms down and bring the feet up to the floor. And now draw the knees in and cross them. Let the knees open a little bit. And just make some circles around the spine. So we're just down at the bottom of the spine, warming that up. Not quickly. We try to keep movements slow because the mind tends to run away when you go too quickly. And then cross at the other side, cross the ankles, and come around the other way. And then come back to the center, and once again bring your feet to the floor. Now bring your right knee into your chest. Take a breath. So we want to make sure we're breathing while we're doing it, and then extend that right leg up and interlace behind it. So you come to wherever you can, come with it lengthening. Try to keep your chin even so you're not up like this with your neck, and sometimes you may need a pillow. So we always honor our own body, and particularly with this back thing. There's so many different things that can be going on, different ways to treat it, so we just try to be gentle with the back. I always do a lot of warming up of the back no matter what. I teach gentle yoga. Some people are limited or have injuries or other things, so I am very careful about that. Draw that leg to the chest a little. Now listen, if you're here and you're not getting a stretch, I kind of lengthen it a little. That gives me more of a stretch. So make sure you're getting something out of it. Extend that back up. cross it over the other leg. So this and this are in line, knee and hip in line. Take your right hand and just open that up a little bit. So you want to just encourage that. And then draw them up, just rocking the knees in and out gently. And then just let it come forward a bit and just gently now, just a small motion side to side. And then come back over and let that left leg come down and draw the right one in. So you put the right knee right in the crook of your elbow, so it's like a baby kind of. I call it rocking the baby. And we just draw that in, so we're getting a nice stretch through this hip here. We draw it in, and then we just rock it just a tiny bit, just a couple inches so, side to side. And if anything does bother you, don't do it. It's that simple, just honor the body. And now draw that right knee back into your chest and extend that left leg long onto the floor. Again, keeping the heel centered. Extend the leg, right leg up, point and flex your foot. And then draw down a little to the chest and push it back up. And then bring this leg down so that it comes over the other foot, so just over the other leg. So we're just placing the sole of the right foot on the other side of the left leg. And just bring the arms out to a slight T. And then let your legs go to the left and let your head move a little to the right. Keeping that upper torso and the head moving right. And take a breath. And then coming back up to the center. Again, extending long and stretching. Exhale down. Bring the feet up to the floor. Now bring your left knee into the chest and extend up. Point and flex the foot. And then draw that thigh down towards the chest, bending it to whatever you need to give it a good stretch. Extend back up. Bend it down. Extend it back up. And then cross that leg over the other one and bring that up to the chest. And just gently rock it in and out a little. And then let it come forward a bit and rock it just a tiny bit side to side. And then bring that right foot down and take the left like the baby in and just pull that in a little bit so you get a stretch in that left hip. And that actually is in the glute. And then go back and forth across a little bit, just a tiny, tiny bit. And then bring that left knee back into the chest and extend the right leg long and let that right leg be on the ground as much as you're able. And then extend that left leg up. Point and flex it a few times, just stretching that leg. Wherever you can, keep your arms long and straight, so wherever you can go with that. And then bring that foot down and place it on the outside of that other leg. Hands come to a slight T, whichever way is comfortable for your arms. And then just let the legs go to the right and move the head over to the left. And take a breath. And then come back up to center, extend your legs and extend your arms. And exhaling down. Bring the feet up to the floor and draw the knees into the chest and just gently rock them in and out. And then see if you can extend your legs upwards. You can hold behind the thighs. We can bring your hands down by your sides. Make sure, again, your chin is not in the air. So try to keep that up a little bit. And then extend your arms up. And if it's good for your shoulders and your body, lift up with the, the eyes up towards the ceiling. So take a breath here. And then come back down and come into happy baby. Bring your hands into prayer in the middle of your legs like that, and then take the outsides of your feet. Soles are towards the ceiling and rock a little side to side. And then come back and try just drawing your toes towards each other a little bit, just a tiny, tiny bit, like in a pigeon toe thing, and try that again. So just feeling that little bit of different sensation in the hips. And then bring the feet together and see if you can draw them out wherever you're able. And take a breath. And then bring the feet back down to the floor and extend your arms forward. Stretch the body. And exhaling down. And then draw your feet to the floor again. And we're going to come into Setu Bandha, bridge pose. So we're going to just walk the hands down, the palms of the hands down as we move those shoulder blades down. We press, the feet are hip distance. We press down with the feet and with the hands and broadening those shoulders against the floor. We lift up, letting the chin come to the chest in Setu Bandha. And then slowly coming down. And now just take your block in the middle here. And we'll just try that again. So let the block, your thighs really kind of grip the block so that you have a nice sensation of, again, of that inward rotation of the thighs. Again, walk your hands down and come up into Setu Bandha. And when we do that, we come into that Jalandhara Bandha, that throat lock. It just kind of keeps our energy right there in place. And then coming down a little at a time. And with the block still there, extend your legs, extend your arms. And exhaling down. And then take the block off, just set that aside. Take your feet as wide as your mat apart. And press down with the small of your back and your feet there, and let the legs go to the right, let your head turn left. Take a breath. Inhale to center, press down with the feet, small of the back, and let the legs go left, head moves right. Big breath. And then coming up to center. And then we'll just bring the legs in, cross them at the ankles, and see if you can hold either here, here, or here. So we just come into Supta Sukhanasana. Just drawing that in. If this is good for you, it's a nice little stretch for the lower back, if you are comfortable. And then coming down. And now we'll just roll over and just come up for a minute. So we're coming to a simple seated position for a moment. Now let's talk a minute about your seated position. Sometimes you're best if you're up on a bolster. So let's talk about that. And why? Because we want to make sure the spine is nice and straight, right? So we're going to make sure that the knees are not, if your knees are way up here, you need to support them. Now when we sit at the edge of the bolster, that allows that to drop down a little. And the knees support it. We have this pelvic bowl here. We think of it as a bowl, and we need to keep it in that upright position so it's not tilted back or forward, so we try to keep that nice. Inhale the arms up, interlace, extend. Exhale down. Inhale, round your shoulders. Exhale back. Inhale up. Exhale back. Inhale. Exhale. Bring your hands back with the tops of the hands at the back of the bolster and lift and open the chest. Now draw your tummy back towards the spine as you do that. And now try to come a little closer together with the shoulder blades. See if you can move those back towards each other again. Again, we're lengthening those pectorals. And then coming to the side, come over one way, stretching the side, come back up, and the other way. And then coming up. And just take a hold of the back corners of your bolster again, lifting and opening the chest. And then relaxing. Okay, so let's come to a table position first. So in table, you know we put the shoulders right over the wrist and the hips over the knees. We get the feet nice and flat against the floor. We inhale up to flat back. Exhale, round and tuck. Inhale. Exhale, round up like a cat. Now in this position, come back up to the table position. Walk your hands forward a little bit, just a little bit. And let's do that again. Inhale, round up. And let's exhale forward. A little bit different. Inhale, round up. Exhale, forward. And then coming back, walk the hands back under the shoulders. And now we're going to extend the right hand and the left foot. And then we're going to draw that in as we hunch in and just take a hold of your left leg with the right, just below the shin there, the knee. with the right hand. And then extend that back out, and then come back in again, reach in, and bring that to the chest. And then again, bring that hand down, extend that foot, and then come back, take a hold of the leg, draw it up, and then come back into that position. Take a breath, and let's try the other side. So we're going to lift the right arm and the left leg. And then we're going to bring it in. We're going to take hold of the leg and draw it to the chest. So it's a little bit of balance too. And then coming down, extending that leg. Again, drawing it in. And reaching back. And up into cat, drawing that in. And then coming down. Now just take your bolster just between the knees and rest your head to one side. And just take a breath for a minute. So while we're in this kind of restful position, we'll talk about sleep for a minute with regard to the back. Now sleep, if you're lying on your stomach, you're putting pressure on your lower back. And if you're sleeping on your back, you can either cause problems or exacerbate problems. So about 40% of all people sleep on their side in a fetal position, which is how I happen to sleep. And that's probably the best way because it puts the least pressure. And actually, it's 2 times more women than men that tend to sleep on their side. I'm not really sure why that is. Now the other thing is, if you're sleeping on your side, it's good to put a pillow between your knees. Now in a private session with my teacher a few months ago, she started talking about this sleep thing to me and suggested that I sleep with a pillow between my knees for my hips. So I do sometimes. And so you can try that if that might relieve some pain. Now turn your head to the other side and just rest. And then we'll come up and we'll just set the bolster aside, and we'll come up, taking the blanket off and setting that aside. I'd like you to come down to your stomach. So let's come down to our stomach and do cobra first. So we bring the arms so that the shoulder, again, sitting over the elbows, pressing down with the feet are flat and back, and just press down with your palms and lift your chest. So just taking a breath here. Good stretch for the back. You don't want to compress it. You don't want to come up so high that it's uncomfortable. Just doing what you can. And then bring your arms down. Bring the backs of your hands beside you. Your forehead to the mat. And then lift everything up. Head, chest, arms, leg, everything comes up. Take a breath in locust. Salambasana. And then come back down. Come over, bring one arm under you this way. Again, shoulder over elbow. Take the opposite leg, lift up. Lift the chest, lift the leg, and then down, and go the other way. So just we want to move the back in a lot of different ways, so it's good to also do this kind of stuff. And then coming up, and just come to child's pose for a moment, just to counter that. And then we'll come up. And we'll just come up to a seated for a minute on your legs. Now, if you can't do this, you can put a blanket here, or you can put blocks here. So there's always a way to modify for that. So if you can sit back on your knees, that's great. Extend your arms, interlace with the opposite finger in front than you normally would, and extend up. And exhale. Reach across. Stretching the arms. Again, the other way. And then coming back. Let's come up and put the bolster right across the back of the legs. Now some of you may be able to do this. Make sure your hip distance, that you're kind of sending the knees down into the floor, and then bring one shoulder at a time back and lift the chest towards the ceiling. And just take a breath in camel. And then one at a time, moving the shoulders up and the head forward. And let's come up to standing now. Bring your block. We'll bring a block to the front there. Let's come on into Tadasana, where we have the feet hip distance. We lift the toes up and spread them and place them down so that we have all four corners of the feet on the floor. And we tuck the tummy back towards the spine. The buttocks kind of drop down as you do that. Move your fingers down beside you. Shoulders move away from the ears. Crown lifts to the heavens. Taking a breath. And then inhaling up, bring one hand to each elbow, lean to the side. And then come back up and the other way. And then coming up, exhale down. Inhale, roll your shoulders. Exhale back. Inhale. Exhale. Inhale. Exhale. Bring the shoulders up to the ears. Exhale, ha, ha. Inhale up. Exhale, ha, ha. Inhale up. Exhale, ha, ha. And now let's bring the block between the thighs and bring it up fairly high between the thighs. And just allow the toes again to move inward a little bit and straighten the legs. So as you do that, you again get that nice intense rotation of the thighs, and the hip moves forward a little bit too. Extend the arms, exhale down. Bring them out to the sides, push away, and then drop the fingers. And then push and drop. And again, so we do that flexion and extension of the hands, always good for the hands. And then coming up, make a loose fist, some rotations. Other way. And now just bring the palm out straight and try rotating this way. So we're doing a lot of movement with the shoulders too. And then bring the hands to the shoulders and just rotate the arms. And again. So again, I'm losing my grip on the thighs, so you want to try to keep that there. And then extending and bringing them down. And you can release the block. So let's step wide. Step wide on our mat. Remember that when we're doing this, we want to go as far as we can. We want the feet to be even and parallel, so wherever you can go to. And then we're going to turn one foot out all the way. And you can loosen the knee a little as you just turn that thigh, just to get that nice rotation. And the back foot will slide in a little bit. And then we extend the arms. And we're going to move back with the torso a little bit towards that back leg a little. And then we're going to bend the front knee. So the forward knee, so that we come into Virabhadrasana 2, Warrior 2. We keep the back leg engaged, the arms long and strong, but the hands are soft and the shoulders too. And take a breath, Virabhadrasana 2. Bring the front arm down onto the thigh. Extend over an extended side angle. Take a breath. Make sure that knee is moving towards the little toe, not your big toe side. Come back up into Warrior 2, gazing out over that hand. Straighten the front leg. Cut back with this hip. Reach, and then come into Trikonasana, triangle. So just lifting the chest so that it's not collapsing down. And then come up. Hands to hip. Feet forward, come to the middle, either walking or hopping, and just jumping a little. And then we'll come again to that wide stance, stepping wide. So anyway, for a minute I'll talk about the back thing. It's the most common physical problem. People lose a lot of time from work over back stuff. It's the cause of most disabilities. Like that's the reason most people are disabled, has something to do with the back. It's usually they've done it at either work or sports or rec or maybe in some home projects, stuff like that. The cause is because things are not lining up for whatever reason. Illness, injury, a sedentary lifestyle, your posture, weight can have effects, so there's different reasons for that. So let's turn that leg out all the way. And let's just try to encourage that thigh by bending first and then twisting and then turning the back toes inwards, extending, remember that nice expansion, and then letting that front knee bringing that front knee down there. So we're bending that front knee. And just taking a breath. Warrior two. Bring the front arm down, extend over. And then coming up again, straighten the front leg and reach forward, and then coming into Trikonasana. And up to center. Okay, let's try chair. So let's do it with the, by bringing the arms up, legs are hip distance, and then we just sit as though we're sitting in a chair. So you can do this against the wall too. You can turn your palms out. Do this against the wall if you have some back issues that might need a little support. That's cool too. And then coming down. Inhale up, exhale. So I'd like to just come down to the floor just a little bit to do a little more side stuff. We're going to do a little on the side. So I'm going to come down and we're going to come to this position with the head on the arms. And then we're going to lift one leg and we're going to push it forward as we extend the heel away, stretching that hip. And then bringing that back. And then we're going to draw it upwards and we're going to press it forward. And then bringing that back, draw it back towards the glutes. And then releasing. Leave your head on your hands, lengthen your legs. And then draw your leg up as high as you can. And then bring it forward. Now make sure your toes are always staying, they're not up towards the ceiling or anything. And then just bring it over and then lower it gently to the floor. And then lift it up and bring it back and move it down. And then try lifting both of them off the floor. See if you can do that. There's a little balance there too. And then coming down. And now let's come up and go to the other side. Let's move down, come onto the hand, stack the legs. And then we're going to move one leg, foot away. We're going to push the heel away, stretching the hip. And then we're going to come back. We're going to lift that up a little and push that leg forward. And then bringing that back and down. We're going to extend the legs. And then we lift that leg as high as we can. And then bringing it forward and letting it come down to the floor. And then up and back over and down. And try lifting both feet. And then coming back down. Okay, and then we're just going to come up. We're going to put our blanket down. We're going to have a few minutes of meditation. And then we will have our Shavasana. So let's put our blanket down. And sit on your bolster. If you have a bolster, again, if your knees are too high, you want to support them. So let's do that. So when we're on the bolster, we want to be towards the front of the bolster as well, so that it's kind of tipping us a little bit forward there. And we bring the hands up. We bring the hands up on our laps. And let's bring the index finger and thumb together in the Gyan Mudra, the Mudra of wisdom and intelligence. And let's do 3 ohms, inhaling to begin. Now for a moment, release the hands, keep the eyes closed, and draw your attention to the crown of the head. We envision there a brilliant light And as we inhale, we draw that light into the body. And as we exhale, we allow that to flood the body. And now for one moment, we bring our attention to the throat chakra, right at the throat. We envision a blue light there. And we're going to chant hum just twice. We're going to chant hum twice. And this throat chakra, this helps us to open the throat chakra, helps us to be more communicative, better listeners too. So let's inhale to begin. Hum. Hum. Now let's come to Shavasana. Remove the bolster beneath the thighs and a pillow under the head. So for now, we just allow the mind to rest. We allow the body to rest. We allow our thoughts to remain descended. We relax the body, just allowing the legs to relax. We notice them as they're heavy on the bolster. The back relaxes. We've taken care of the back today, and we're just letting that relax on the mat. Shoulders release away from the ears. Soften the face, soften the corners of the mouth, relax your tongue, relax your eyes. Now gently wiggle the fingers and the toes. And then just roll to your side and rest there for a moment. With a feeling of acceptance and surrender. Now, slowly, keeping your sense of tranquility, bring yourself to a simple seated position, Sukhanasana. Draw the hands to heart center and bow the busy, intelligent, intellectual corporate mind to the more intuitive wisdom of the heart. May the long-time sun shine upon you. All love surround you, and the pure light within you guide your way home. Namaste. Thank you.